As you go through head and neck radiation treatment at MD Anderson Cancer Center, it's important to prioritize yourself. It will take time to recover from side effects, and every patient is different. Before starting any radiation, you will meet with your care team for a planning session called a simulation. The care team will take measurements and make a custom mask for your treatment. Your treatment plan will be ready 7 to 10 days later. Once you start radiation, you'll have treatment Monday through Friday for about 5 to 7 weeks. It's important not to miss any appointments. Missing appointments will reduce the success of the therapy. Your care team will likely take images every day at the treatment machine to ensure you are in the correct position and the radiation will be delivered as planned. To prepare for treatment, the radiation therapist will place the custom mask on your head. Depending on your treatment site, they may give you a mouthpiece. You will wear the mouthpiece and mask for every treatment. After treatments, you are not radioactive, so it's okay to be around other people. However, you should avoid people who are ill because your immune system may be weak, especially if you are also receiving chemotherapy. Throughout treatment, you'll see a radiation care team once a week in what's called a weekly C-visit. This appointment is required to continue treatment. At each weekly C-visit, your care team will check your vital signs and weight. Your doctor will see how your cancer is responding to treatment, make any needed changes, and manage your side effects. Side effects of radiation are often mild at first and may slowly get worse throughout your treatment. Some side effects may continue after treatment ends because it takes time for healthy cells to recover from radiation. Most go away within a few weeks of ending treatment. The severity of side effects varies from person to person. This depends on whether you are also receiving chemo or immunotherapy, the tumor size and location, any previous treatment, and other health conditions you may have. Radiation may inflame and irritate the skin. This is called dermatitis, which may feel like a bad sunburn. As treatment progresses, your skin will turn pink and then dark red. Your skin may also become dry and peel, and then possibly feel wet. Your care team will manage this. In the treated area, you may also have some itching or burning. About 2 to 3 weeks into treatment, you may experience hair loss. To help care for your skin, always wash your hands before applying products. Start applying the recommended skincare products on the first day of treatment. You may apply the products at least 2 times a day. However, do not apply 2 to 4 hours before treatment. Use your hands to wash the treatment area every day with a mild soap and warm to cool water. Do not use loofahs or washcloths. These can irritate the skin. Pat the skin dry gently. Do not wipe. Avoid direct sunlight. Wear a wide-brimmed hat to reduce sun exposure. If your neck is being treated, wear a loose-fitting shirt with no collar. Do not soak in hot tubs or swim in pools. Do not wear makeup, fragrances, or sunscreen in the treated area. If you want to shave for comfort, use an electric razor with alcohol-free shaving cream. Radiation, especially after surgery, can cause scarring on your neck and jaw, which can lead to stiffness. Your care team will teach you jaw and neck exercises to help with this. Start the exercises the first day of treatment. Continue them 3 to 4 times per day for at least 1 year after completing radiation, and as instructed by your care team after that. Stiffness can worsen long term. If your nasal area or sinuses are treated, you will develop increased nasal secretions and congestion, dryness, swelling, crusting, and mild bleeding. To help manage these symptoms, use an over-the-counter sinus rinse with distilled water and a nasal moisturizer. Do not use nasal decongestants as they may cause burning and stinging. Apply a skin protectant ointment around your nostrils to help keep this area moist. Most patients will see a dental oncologist before starting treatment. Follow their instructions about brushing and caring for your teeth. Treatment to the salivary glands around your jaw will cause dry mouth. Using baking soda rinses 4 to 6 times a day will help maintain the pH balance in your mouth, decrease risk of infection, and prevent discomfort from dry mouth. Radiation can cause mouth sores in the treated area. Do not eat or drink products that cause more irritation. These include alcohol, spicy or heavily seasoned foods, extremely hot or cold foods, acidic foods such as citrus or tomato juice, carbonated drinks, and sharp foods such as potato chips or pretzels. Radiation can cause taste changes, which may cause foods and fluids to be unpleasant. If this happens, try eating different foods or eating smaller meals. If you can't eat enough food by mouth and lose weight, you may need a feeding tube to meet your needs. A dietitian will check in with you every week. They may suggest softer foods and nutritional drinks that are easier to swallow. You must maintain enough weight to fight the cancer and help heal your side effects. Radiation to the neck and throat can cause swelling, pain, and problems swallowing. This usually begins around the second or third week of treatment. You may receive a prescription for pain medicine to help reduce the pain. As radiation progresses, the saliva and secretions that line the throat will become thick and sticky, and you may see some small amounts of blood. This is normal. The thick secretions can make it difficult to swallow, drink, eat, and even sleep. To help with thick secretions, drink plenty of fluids. Rinse with the baking soda and salt mixture. Swish and gargle semi-flat diet ginger ale. Use a cool mist humidifier in your bedroom to help prevent dry air. Clean the humidifier to avoid infections. Sleep with your head at a 30 to 45 degree angle to help prevent gagging and possibly inhaling secretions, which can lead to pneumonia. Your care team can suggest medicines that may help loosen or dry up the secretions. If your voice box or larynx is treated, your voice may become hoarse as treatment progresses due to swelling. This is temporary and usually improves after treatment ends. If any part of your ear canal is treated, you may have fluid buildup in your ears that can cause hearing problems. To help with decreased or muffled hearing, your doctor may refer you to an ear, nose, and throat doctor or ENT. Fatigue is the most common side effect and increases as treatment progresses. It may last for weeks or months after treatment ends. Manage fatigue by getting plenty of sleep, taking short daytime naps, and doing light exercise like walking. Constipation may be a side effect of medicines, such as anti-nausea or pain medicines, or from changes in the food you eat. Ask your care team about how to take stool softeners and laxatives to help promote regular bowel movements. Have a supply ready before you begin treatment. If you have uncontrolled bleeding, persistent nausea or vomiting, uncontrolled pain, fever of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher, or difficulty breathing or shortness of breath, go to MD Anderson's Acute Cancer Care Center or the nearest hospital emergency center. Some side effects may continue after treatment ends because it takes time for healthy cells to recover from radiation. In some cases, changes may be permanent. If you were able to maintain your nutrition during treatment, your skin may heal in 2 to 4 weeks and your mouth sores in 4 to 8 weeks. Taste changes and dry mouth symptoms can take 6 months to 2 years to recover. Depending on the radiation dose, hair loss may be temporary or permanent. It's important to continue to do the self-care measures as your doctor prescribes, even after treatment ends. Your first follow-up appointment will be about 8 to 10 weeks after your last radiation treatment. Follow-up care is important. If you need support between your appointments, contact your care team through MyChart.